is impacting Black women and birthing people. My name is Dr. Ayana Robinson, and I am the Director of Research and Evaluation at Black Mamas Matter Alliance. We are thrilled to have two of our alliance partners today, Feminist Women's Health Center and Choices, joining us to highlight their work and research surrounding abortion care and access post the Roe v. Wade decision. But before diving in, some quick updates. Black Mamas Matter Alliance has more exciting events coming up, like our Black Maternal Health Conference and Training Institute taking place September 12th through 14th in Atlanta, Georgia. Please be sure to sign up for our e-newsletters to be the first to secure your registration for the Black Maternal Health Conference and Training Institute. Also, for more information on issues and policy recommendations impacting Black maternal health, please be sure to check out BMMA's comprehensive policy agenda on our website at blackmamasmatter.org. And finally, for everyone who wants to get involved, be sure to follow us on social media platforms and again, sign up to receive our e-newsletter. Throughout this conversation, we will be adding links to the chat. So check the chat, check the links for everything that I've mentioned so far, and for more information as we progress through this conversation. We want to thank you again for joining us today and hope that you have had a wonderful Black Maternal Health Week. For those who are just learning about us, Black Mamas Matter Alliance is a national network of Black women-led organizations and multidisciplinary professionals whose work is rooted in birth and reproductive justice, respectful maternity care, and the human rights frameworks. BMMA provides technical assistance, training, and capacity building for grassroots organizations, maternity care service providers, academia, and also public health sectors in order to advance maternal health equity. This year's theme, Our Body Still Belongs to Us, Reproductive Justice Now, underscores the ongoing fight for reproductive justice for Black women and birthing people in the face of widespread abortion restrictions and rising cases of criminalization due to pregnancy loss. BMMA demands comprehensive healthcare access, improved birthing options, equitable treatment from healthcare providers, and research that centers the voices and needs of Black women and birthing people. And so with that, we officially want to welcome and thank our two amazing guests for joining us today. Kwajalein Jackson, Executive Director of Feminist Women's Health Center, and Dr. Nakia Grayson, Director of Clinical Services at Choices Center for Reproductive Health. So I'm going to read bios and then we'll jump into our questions for our panelists. Our first guest is Kwajalein Jackson, who currently serves as the Executive Director at Feminist Women's Health Center in Atlanta, Georgia, leading the entire organization's operations, abortion clinic, civic engagement, education, and outreach teams. Since 2013, Kwajalein has led the expansion of Feminist Women's Health Center's statewide and national impact and significantly deepened community partnerships. Under Kwajalein's leadership, the community education and outreach work has been expanded, has had impactful successes, including preventing new abortion restrictions in the legislature for 4 sessions, the launch of the Aaron J. Vully Fellows Program, and solidifying ties for funding partners. Next, we are also pleased to welcome Dr. Nakia Grayson, Director of Clinical Services at Choices Center for Reproductive Health. Dr. Grayson is a public health activist, anthropologist, and nurse who has devoted her life to serving and empowering people in underserved and marginalized communities for more than 20 years. Working interdisciplinary in the areas of culture, health, and education, Dr. Nakia's work has explored the associations between power, culture, and gender. Dr. Grayson received her bachelor's degree in communications and a master of public health degree at Howard University. She earned a master's of art in medical anthropology from the University of Memphis, a master's of science in nursing and doctor of nursing practice degree from the University of Tennessee Health Science Center, and her midwifery education from Frontier Nursing University. In addition to her work at Choices, Dr. Nakia also serves as an adjunct professor and women's clinical instructor with the Midwives College of Utah. Welcome again, Kwajalein. and Dr. Nakia. We are so grateful to have you both here to talk about the crucial work that you're doing and leading at your respective organizations, especially in the aftermath of Roe v. Wade overturning. So let us jump right into the questions for today. Also, for our audience, feel free to share comments, reactions, questions, also in the chat. And time permitting, we have until about 12:30. We will open up for a few audience questions at the end. All right. Well, to start, tell us about your organization and the services that you provide, including abortion services and care.
Thank you, Dr. Robinson, and I'm always thrilled to be on a Zoom with Dr. Nakia Grayson, or in any space with Dr. Nakia Grayson. Feminist Women's Health Center has been an abortion provider and comprehensive gynecological care provider in Georgia since 1976. So currently, we provide both medication and procedural abortion care up to the point at which fetal cardiac activity is detectable via ultrasound, which I'm sure we'll get into, why I have such a distinct answer for exactly how far in gestation we can provide abortion care. But in addition to that, we provide, as I said, comprehensive gynecological care, gender-affirming care, STI and HIV testing and treatment, contraceptive services, and we are working tirelessly to continue to grow our lines of service to serve more folks across the reproductive health spectrum. Outside of our clinical services, we do advocacy, outreach, education, leadership development, civic engagement, and movement building across Georgia and across the Southeast. So we consider ourselves both a reproductive health, reproductive rights, and reproductive justice organization because our activities really work at the intersection of all three.
Thank you, Kwajalein.
Yes, it's always a pleasure to be in Kwajalein's presence. She's so amazing and wonderful. I learn so much from her every time we're together. Like you said, I'm Nakia Grayson. I'm in Choices Center for Reproductive Health in Memphis, Tennessee, and now in Carbondale, Illinois. We've been in the community for 50 years. This is actually our 50th year in Memphis. We plan to be there for 50 more. So we were the first nonprofit, healthcare provider really in the country to offer, both birth services and abortion in the same place. And like I said, we've been in the community for 50 years now. We have lost abortion access completely in Tennessee. We have no exceptions, unfortunately. And our Memphis, Tennessee clinic continues to provide gynecological care, family planning, transgender care. So we provide gender-affirming hormone therapy. We have about 250 transgender patients, but we also provide midwifery care. We are a Black midwifery-led organization, which is amazing because when we started our midwifery services in 2017, not only were there no community midwifery clinics like ours, but that just these options were not available to many of the families that we serve. So we provide midwifery services. So we do prenatal care, birth and delivery in our building, as well as postpartum care. I tell everyone that we care for people who want to be pregnant and don't want to be pregnant. We care for people along their reproductive lifespan. But we also, in answering what happened with the Dobbs decision, we recognized when the Dobbs case was being taken up by the Supreme Court that we were going to lose abortion access in the South. And so we were very proactive about this and opened a second clinic in Carbondale, Illinois, which is about 3 hours from our Memphis clinic, where we provide abortion care as well as gender affirming care and family planning services. And we've been doing that since October of 2022. Our clinic is grounded in the principles of reproductive justice. Choices center those with the least access to quality, affordable, inclusive care. And we provide a full spectrum reproductive and sexual health services. And we have done this, like I said, in our community for 50 years now. It's really important to us that, like I said, we are Black midwifery led, and it was really important for us to see reproductive justice in action. So that's it. And we'll talk a little bit more about all the other things that we do.
Yes. Incredible, impactful work. Thank you for sharing across both organizations. And we're going to talk about the research, but Dr. Nakia, you started to mention already the initial impact of the Dobbs decision. Kwajalein, can you also tell us a little bit more about how the Supreme Court decision initially impacted the services you provide?
Absolutely. So the Dobbs decision was in June of 2022, but the law did not change in Georgia immediately. We had what we call a 6-week ban that passed the Georgia legislature in 2019, but it had been enjoined and blocked by the courts while we contested that piece of legislation. And we did not have a final ruling on it at the time that the Supreme Court ruled. So we were still able to provide care in the few weeks after Dobbs. So we began seeing an onslaught of patients from around the Southeast. One thing I'll just mention, because I know it'll come up, is that patients have been traveling for abortion care for many, many years before the overturning of Roe. But with the states where total bans went into effect basically immediately upon the Dobbs decision, people had to act very quickly. So we had hundreds and hundreds of calls from Alabama and Tennessee in particular of patients trying to reschedule as quickly as they could. So we tried very hard to manage our staff capacity in order to accommodate as many folks as we could in that amount of time. But the law went into effect in Georgia in July, late July of 2022, where we had to shift to providing only services, again, as I mentioned at the top, up to the point at which fetal cardiac activity is detectable via ultrasound, meaning that it's not an explicitly weeks and days measurement. It is a fetal development measurement. So it could be 5 weeks and 5 days. It could be 6 weeks and 2 days. But really, the ultrasound is the point of demarcation for when we can see someone and care for them versus we have to send them away disappointed. And they have to start a process over. So the other thing that I'll note is that Georgia's law does have exceptions. So we are able to care for abortion patients whose pregnancy is a result of a sexual crime, like rape or incest, or if they have a fatal fetal anomaly, that pregnancy is incompatible with life outside of the uterus. And in what is in some ways a little bit more legally ambiguous in medical emergency situations. And so there's a lot of work that's happening in the legal community to better define exactly what constitutes medical emergency that would allow for us to provide care in those circumstances. But even though exceptions we know are not sufficient to actually meet the needs of people who want to terminate a pregnancy, it's still important that they exist because we are able to care for, again, folks traveling from around the region who live in states where there are no exceptions to the bans that they're living under. So, I'll just say we had about 15% of our patients come from outside of Georgia to get care at Feminist Center. And again, the majority of those folks coming from Alabama and Tennessee.
Mm-hmm. Thank you for adding Kwajalein. And Nakia, is there anything else that you want to add about how the decision initially impacted your services? We know there was a total ban. You all
Yeah.
quickly were able to pivot to provide services in Illinois. Is there anything you want to add?
Well, like you said, there's a total ban in Tennessee, and it still is, and we're still fighting that as well. When the decision came down in June, we knew because we had a trigger law that we would lose access to services very quickly, and we actually were the last clinic in Tennessee to perform an abortion, and that was in August of 2022. It was devastating to the community. It was devastating to the people that we were serving, and like Kwajalein said, many of them were traveling distances to come to the clinic, especially because Mississippi only had the one clinic, and the surrounding states had similar trap laws or targeted regulations of abortion providers. And so what we did see was us scrambling really to help people get to new spaces like Atlanta, who did have some exceptions, but really working fervently to get people to states, well, really to Illinois, because Illinois was the closest state that we could get them to, and at the same time working really hard to get that clinic open. So we moved quickly, and fortunately we had a lot of support from the state of Illinois to move as quickly as we did to get that clinic up and going and get everyone credentialed as quickly as possible. But it was really important to us that we continue to provide this service, and a lot of the patients that we see in our Carbondale clinic are coming from Tennessee, Mississippi, Alabama, Texas, the same states that they were coming from initially, because the care, while Roe was, while it was legal to have abortions, they still didn't have access in their community. So they were still traveling distances to access that service. And that's what we're still seeing now.
Thank you for sharing. So we want to pivot and discuss some of your research efforts around services and access and the challenges with patients seeking abortion care and services, the challenges with providers and providing those services specifically to Black women and birthing people. So can you tell us about the research that you all have been conducting so far, aiming to conduct? What's kind of the scope of it? And we can start also with any particularly findings around challenges, needs for Black women and birthing people from your research.
Oh, you okay? Yeah, so I mean, the research we're doing, well, before we lost access, we were actually working on a project with an organization where we were looking at using medication abortion at a later gestational age. Unfortunately, we had to halt that work immediately, which was going to be really amazing work, especially to show the efficacy of using mifepristone and misoprostol at a later gestation past 10 weeks, right? So but presently the work that we're doing really is centered around understanding what people's experiences are, right? So we're looking at the experiences of Black women and birthing people around the challenges that they're experiencing around accessing abortion care, but also the needs in accessing abortion care since the overturning of Roe. Also, we are working on a project with actually BMMA, and Nia Mitchell is helping us to really work on operationalizing what it is that we do at Choices, and helping us to publish a full spectrum midwifery model of what it is that we're doing to operationalize, like I said, our model, so that we can provide training materials for clinicians and also to show how our practice is aligned with reproductive justice, right? And so also we're working on research projects around training to equip midwives to provide abortion care and to really be able to provide education around self-managed abortion in our communities. And so Many people don't know that midwives in some states can provide abortion care. We could not do that in Tennessee. Fortunately, we can do it in Illinois. And so that really has been a game changer for us, especially having the clinic now in Carbondale, Illinois. But what we're seeing is since the overturning of Roe, more midwives wanting to get this training that they were not getting in their programs in their nurse midwifery programs, but they're seeking these opportunities post-education. And so we're doing research on how we can provide that for them and really how we can train as many people as possible to be a help in their own communities.
Thank you.
Well, we're trying to get like choices. It's a short answer to your question about research. One of the projects that we are currently leading is similar to what Nikki just described, trying to put together focus groups where we can gather the experiences of both birthing people in Georgia and birth workers in Georgia in attempts to learn more about what it might look like for us to expand our care to include perinatal services. So we are also working directly with the research team at BMMA to help us to create the focus group instruments that will allow us to learn about honestly, not just Black birthing people. We're also trying to develop focus groups in our Spanish-speaking communities, as well as learn about the birth experiences of queer and trans folks in Georgia. What has been working, where the gaps exist, what things they desire from their prenatal and postpartum experiences, and how we can create a more robust ecosystem that supports pregnancy options. We have participated in lots of other kinds of research that we have not necessarily been the lead, but where that research has like taken place in our clinical site or has been recruiting from our patient population. But we're really excited. We've just created a new position at Feminist Women's Health Center called our Director of Clinical Innovation and Liberatory Research. So now we have the staff capacity to really be able to hold and lead community-centered research in the future. So excited about more opportunities to be able to learn from and with our community.
Awesome. And we are excited as well at BMMA to be able to support both of these ongoing projects. So we were discussing challenges, issues among like the patient population. And so I want to pivot a little bit, and maybe Dr. Grayson, you could expand here specifically about the challenges and needs for providers who are trying to provide these services to Black women and birthing people post-ops. What are you learning? What are those challenges?
Yeah, this is really interesting because what we're seeing is that the providers are confused, right? They're not sure what they can and can't do. It's one thing to be concerned with being sued for malpractice. It's another thing to be concerned about having criminal charges brought against you and having your license and livelihood being taken away from you. So one of the projects that we're working on, a research project that has been ongoing at the clinic, has been to talk to different clinic staffs about their experiences, and also with our Carbondale clinic. Carbondale is a very new space to have in abortion care. So that clinic staff experiences have been very different than our Memphis clinic staff that has been doing it for 50 years, right? So what we found is that the clinic staff, especially the providers, are a little bit more concerned about their safety. They're also concerned about their perceptions in the community. Carbondale is a very small community. And with our Memphis clinical staff, our biggest concern from what we found through our research is just understanding what our risk is, right? Like I said, it's different to be concerned about being sued for malpractices versus having your legal freedom taken away from you. So yeah, so we're working on what does that look like? How do we help to mitigate those risks, but also how do we help clinicians know what their rights are and really know what the law says? And it's a lot of ambiguity there because
Yeah.
no precedence has been set, and you definitely don't want to be the person to have that precedent set, right? You don't want to lose your freedom or ability to practice and have your livelihood based on some laws that we know that are just totally archaic. So yeah, so what we're seeing is that providers are really concerned, and that providers also are not acting quickly in the community to help people because they're not sure what they can do, but they also are not sure legally about their own rights. So we're hoping to be able to really write more about that and those experiences.
Thank you. Go ahead, Kwajal.
The only thing I'll add to what Dr. Grayson shared is that we're also really concerned about the future workforce. Many, both nursing and residency and fellowship programs for medical physicians have been trained in independent abortion providers. Like that has been the ongoing training ground for many clinicians to get that experience. And as we lose community-based clinics, as clinics lose the ability to provide abortion care later in gestation, we are also losing learning spaces. And, to Dr. Grayson's point, this idea that people might not feel comfortable or confident practicing in a place where the law continues to change so rapidly and their safety remains so precarious. And so I imagine that as we continue to see the laws around abortion change, we are going to lose reproductive health care providers across the spectrum because they're not willing to take some of those risks. So the Southeast and the Midwest in particular are at risk of losing really necessary, well-trained, skilled, and experienced reproductive health care providers if we don't create an environment in which they can thrive and they can work in their expertise.
Absolutely.
Yeah, but you know what, also, Kwajalein, to add to that, what we're doing is we're also losing providers in our community. I mean, they're
That's
not
right.
going to come to the South, you know,
That's right.
and I've been taking an informal poll around when I go to speak at different grand rounds and residency programs here in the South, and, you know, just to see who is coming to the region. And we are not having all the folks that I've been polling have come from that region. They're Southerners already. So we're not going to get or attract talent to these southern states because they're concerned, and these residency programs really need to be aware of that, and I'm sure they are.
Yeah, absolutely.
Thank you both. So we are actually coming to the end of time. This has been insightful and informative, and so grateful in the brief time for what you all have been able to share with us. So in closing, how can we stay up to date on your work, and what are ways that people can get involved?
Well, certainly we are on social media. So that's one place where folks can follow us. So we're at Feminist Center on Instagram. We're still on Facebook. I think we're still on Twitter/X. And we might even have a TikTok account. I'm not on TikTok, so I'll be seeing it if we're over there.
I don't know.
But we also have a newsletter. So I would encourage folks to go to our website, feministcenter.org, sign up for our newsletter where you can get opportunities to volunteer, to follow our progress, to follow what's happening politically. We certainly are going to be very heavily involved in civic engagement and get out the vote work this election year. And so talking to folks about the ways that not just abortion, but many issues surrounding reproductive health rights and justice are being played out in our political sphere locally and federally. So I would encourage folks to get involved in those ways as well. And then last thing I'll say is just remember to support your independent abortion providers and your independent funds. Many of us are nonprofit organizations that can accept donations and financial support, but we cannot afford to lose independent providers across the country that have historically provided the majority of abortion care and continue to rise to the occasion when the laws like try to pull the rug out from under us.
Mhm.
Yeah, everything that Kwajalein just said. I mean, we have to really recognize that these independent clinics have been in the community for, like I said, 50 years and have been providing the majority of care. And we want them to continue to be there, right? So you can find us on Instagram and Facebook, and I think we may have a TikTok also, Kwajalein, I don't know. We're aging ourselves, right? And probably still have a Twitter account too. I don't know, but you can find us at yourchoices.org. That's our website. And also our Instagram handle is Your Choices. Your Choices Clinics, which is also our Facebook. So yeah, definitely keep in contact with us and reach out, because we are doing a lot of advocacy work around abortion care, but also around Black maternal health and advocacy for the advancement of midwives in our community, and for midwives to be able to have full practice authority in their communities as well. We know all the things that are happening in Georgia as well, and we're supporting that work to get more midwives into the community there in Georgia. But yeah, we're just we're just out here fighting every day, fighting to stay alive, fighting to stay in our communities, to continue to provide high quality, non-judgmental, fact-based care. And I gotta say fact-based care, that's really important. And yeah, so reach out to us. Like Kwajalein said, we are a nonprofit organization as well. And one of the ways that we've been able to thrive is really through donations and contributions from our community.
Thank you. Thank you again, both, for joining us, Dr. Grayson and Kwajalein. We have so much appreciation and gratitude for the work that you all are doing in your communities. And we, again, are looking forward to the research so we can better understand the challenges and what are the barriers, and how we can better understand better serve Black women and birthing people as well. So be sure, as I mentioned, to check out Feminist Women's Health Center on IG at Feminist Center, and also Choices at Your Choices Clinics. And you can get involved with BMMA by signing up for our newsletter at blackmamasmatter.org/connects. Be sure to turn on your post notifications on Instagram and follow us on all of your social media platforms. Thank you again, everyone, for joining us, and have a great rest of Black Maternal Health Week.